Why is keyhole surgery vastly superior as a procedure for appendicitis?
So for the last 23 years, I've only performed appendicectomy by the keyhole method. And it's a well-established way of doing surgery, both for adults and children. Now, with appendicitis, the appendix is on the right side. We make small cuts in the belly button and 2 other small cuts on the tummy to introduce the instrument. The belly button incision is for the camera to look inside. And those are the only 3 incisions required. Whether the appendicitis is a severe one where it's burst or whether it's a minor one, you can get access with those 3 incisions. With the open technique, you have to make a cut in the right side of the tummy over where the appendix is. And often in a bigger child, you need a bigger cut to get access to the appendix. And secondly, if it's one that's perforated or the appendix is burst, you need a bigger cut. So doing an operation for appendicitis with the open technique, you can get variable incisions depending on the severity of the appendicitis. With the keyhole method, the same incision is required for either a minor operation or a severe operation where there's perforation and pus all over the tummy. We can get access to under the diaphragm right to the pelvis by doing the keyhole surgery. A cut here just on the right side for appendicitis, you cannot get access to the pelvis or anywhere else if the appendicitis is a burst appendicitis. And with the keyhole technique, the recovery is so much faster. We have to deal with 3 small incisions. The cut that you have with the open technique, you have to cut the skin, the fatty tissue, the muscle, then go into the abdomen. And then once you've done the operation, you have to repair all these structures. So there is significant pain and recovery required for a bigger cut compared to the tiny little dots that we make for the keyhole method. Not too long ago, I had a little boy of 10 who had his appendix removed in his local hospital by the open method. So he had appendicitis, he had appendicectomy done by open method. The surgeon made a reasonable cut, about 3 or 4 centimeters, took the appendix out. A couple of months later, he had similar pain. At that time, he came to my hospital. My radiologist did a scan and he explained to me it was a recurrent appendicitis, to my surprise, because the boy already had his appendix out. So we had to do a keyhole surgery to look at his appendix. And to my surprise, I saw that he still had a small little stump of appendix with a little fecal. Basically, it's a little fecal lump that caused the appendicitis. So what probably happened was that the access and the view of the appendix was pretty poor through the open technique. So the surgeon couldn't have seen the whole of the appendix. And he only took maybe 3/4 of the appendix out and leaving the quarter of the appendix, which caused a recurrent appendicitis. So when I removed the whole of the appendix, he recovered very quickly and very well. So that is another good example of view that the laparoscopic or keyhole surgery allows a surgeon to see the whole picture, which doesn't give you as good an access by the open technique.